you some Botox treatments today. This lovely young lady had Botox about 4.5 months ago, so she probably still has a little bit of product left. So we're not gonna have to do a ton of Botox in order to keep her looking lovely. The important thing to remember about Botox is the more consistent you are with using it, the longer it's gonna last and the less product you'll have to use over time. So I already prepared the Botox earlier. We talked about what kind of treatments we were going to have done. The treatments that we're doing today are going to focus on the glabella, which is where people talk about the angry 11 line. So make an angry face for me. Perfect. And then we're going to do a little bit of a brow lift. So we'll do a little bit of Botox out over the brows and then raise your eyebrows up for me. And then we're going to tackle these, this area up here, which is called the frontalis. Okay. The face is the only place in the body where the muscles are attached directly to the skin. So the reason Botox works to help get rid of lines is because when it relaxes those muscles, that it's not flexing in the same place over and over again. Okay? Are you set?
Ready.
All right. So I'm going to put my thumb in your eye just to kind of protect you from when we're doing the injections. All right? So you're going to feel a little pinch here. Okay?
Mm-hmm.
And I don't always put all of the Botox in one syringe because I like to have a little bit more control. So I do smaller doses. Turn your chin towards me just a little bit. Oh, big stick here. Okay. And now raise your eyebrows up one more time. Mark where we're going to do the injections here. The nice thing about doing Botox in the forehead too, big poke, is that it can help decrease sweating. So if you have an issue with breakouts on your forehead because of you work out and you sweat, the Botox can help to decrease that. Okay. Now the little mosquito bite looking things will go away in about 15 to 30 minutes. With Botox, you can ice if you want, if you're uncomfortable. You can use Tylenol, ibuprofen, any of that stuff that works for pain. But generally, most people don't need anything. Once you get Botox done, no tight hats or headbands until this time tomorrow, and no facials or massages where you have to lay in that pillow for 24 hours, okay? Because we just don't want the Botox to move around. The other thing is no laying flat for 4 hours. So go home, watch TV or whatever, but don't go to bed until you've had the Botox in for about 4 hours.
Okay.
Very rare for it to move, but it can, and so we want to give it time to set up in the muscle really well. All right?
Great.
Okay, so that's Botox 101 at Elevation Med Spa in Lone Tree.